Welcome to Health Authority TV. My name is Devin DeVries. I'm the editor-in-chief of Health Authority Books, and our mission here at Health Authority TV is to bring together a community of health business experts and find out what's happening currently in their world and then look to future opportunities. Our guest this week is Isaac Justesen, founder and CEO of Patient Partners. Welcome, Isaac.
Hey, welcome. Thanks for having me on the show.
Yeah, it's so nice to have you. To start off, we would love to hear, who, who do you serve as a health authority?
So, we serve physical therapy practices in North America. Now, our primary kind of clients are ones doing about over $1 million in revenue that kind of have a bigger budget and bigger need for marketing. But we work with everything from solopreneurs just starting their practices to, clinics with 10 plus locations.
Nice. And then what services do you provide them?
So we are a full service digital marketing agency for these clinics. So that includes everything like website design, SEO, Google Ads, email marketing, social media. We even do a little bit of print advertising for these clinics here and there, but digital is for sure the biggest one. And but really, the idea is we try to be a partner in their
Yeah.
growth, and because as clinic owners and any other business owners in the health space know, marketing is just sort of one aspect to growing the clinic. And so we're supporting them with everything from operations to sales to recruitment sometimes even, and really just helping these clinics grow.
Yeah, that's wonderful. And I think we've all kind of seen that they're very, very busy just serving their patients and doing, all the really important work they have to do, that some of that stuff kind of will fall to the wayside or, you know, is just taking their time from something, more important. So it's really nice that to have that kind of partner that they can rely on.
100%. Yeah, they're focused on serving patients and their team and things like that. And so it's pretty easy for marketing and ops and some of these other things to slip between the cracks. And then that's when they call someone like me to come in and give them a hand.
Is there any of the services you do, is there anything that you kind of recommend as, the top couple options, or is it very case by case?
So I would say that's a good question. Local SEO, I think, is a major one. If you're searching for physical therapist in San Jose, California, or you're searching for, I think this is the case for all kinds of local service businesses where a lot of people, the first thing they do when they're looking for a plumber, a dentist, a PT, you name it, the first place they go is Google, and they just search for physical therapy clinic near me or, insert city here. And so ranking highly in that sort of that map pack, but also in the organic listing of websites is absolutely, it's just so important. Of course, Google Ads are another great way because you can kind of buy your way to the top. But in terms of your long-term benefits, SEO, I think, is still the number one channel for these types of local service clinics and healthcare practices.
Oh, good to know. All right, so now we'll move on to kind of the meat of our discussion. And this is the question we're really trying to get going in the community as a whole. So based on your experience as a health business authority, how can we redesign America's healthcare system?
I mean, I'm sure there's a lot you could say on this topic, but from the lens of physical therapy, I think one of the biggest things is more of an emphasis on prevention and early intervention. I feel like a lot of the healthcare system is really focused on patients when they're in crisis, they've had a big issue. Whereas PT clinics are positioned really well to help with actually preventing some of these things. And addressing chronic pain, improving mobility, and all of that is kind of can come before surgery or medication and things like that. And so in terms of, okay, so how do we actually redesign the healthcare system to support this? I mean, I think it's more about access, providing more access to physical therapy and sort of making that the norm, rather than sort of the exception.
Yeah, that makes sense. Kind of get ahead of some of these things.
You got it. You got it. And now from a marketer's perspective, there's lots that goes into that as well. Like just for example, part of the job of a marketer for these PT clinics is actually around sort of education and adjusting some public perception, perhaps even because I think for a lot of people they think of PT as sort of post-surgical. So you blow out your knee, you have an ACL surgery, then you go see your PT for 8 weeks or 12 weeks, and you never call them again, kind of thing. Hopefully, you don't need any more injuries. But with marketing, we can kind of educate people and position these clinics as more of a first, a frontline solution to, helping them relieve pain, helping them improve mobility, restore function. For people that are into sport or athletic, it can actually help improve their performance. And so part of the job as a marketer is actually, educating people and, not just about the benefits of physical therapy and how it can help, but also, helping people understand, okay, like this is the insurance coverage. This is actually how it can be pretty cost effective and help you prevent medical bills or things like that down the road. And so I think a big barrier for a lot of clinics is and people is not just access to PTs, but actually sort of the awareness and the understanding of these are all the different ways they can help me. And here are some of the different, whether this is more traditional musculoskeletal physical therapy where we're talking about shoulder pain and back pain and things like that, or things that are more specialized like laser therapy or pelvic floor therapy for pre and postpartum women. I mean, there's such a breadth of potential ways that PTs can help support people and support their community. And so, part of the job as the marketer is obviously not to do any of the clinical stuff, but to teach people about this sort of breadth of opportunity and ways that a clinician can support them.
Yeah, I really like that point because yeah, I think I would have put myself in the camp of like, yeah, PT is, you know, an accident related or yeah, you had surgery, but other than that, like I can't, I wouldn't have a need or I wouldn't have the insurance to do it. Like I wouldn't have even thought that may be a possibility. Um, I think there's so much that we have in health insurance, we have no idea as the consumers. Like we don't even know what we have access to so often. So, and that is a big piece. And obviously, from our side of doing books and trying to help, health professionals get their message out, this is what we're seeing. It's really that goes all back to that education piece of, how do we get this important information out to the right people?
Totally, exactly. And that's where really the website for a lot of these clinic comes into play, where it's that's sort of their primary vehicle for educating people is the website and the information you're putting out there and uh, things like that. And so one other point I guess I'll make in terms of um, redesigning the healthcare system and from the lens of a marketer for PT clinics is actually around the digital marketing component of actually some clinics are still a little bit behind in that world and most of them probably have some semblance of a website these days, but maybe it's just not something that they've prioritized or put a lot of energy into, and so it's actually such an important thing. And so maybe from this perspective, in terms of how it's redesigning, like it's almost from the clinic owner's perspective of, this needs to be something that gets worked on and gets sort of prioritized a little bit higher, is making websites accessible, making them easy to read, making it easier for people to become patients with online booking and really transparent pricing and telehealth options. And so just making the industry a little bit more accessible, from a marketing perspective and a digital perspective, but also just in general for the patients. So yeah, making it easier for people to actually get the care that they want and they need. And um, sometimes that's a marketing job, and that's kind of where we help out.
Well, I really appreciate you taking the time to share the perspective with us. And I don't think we've had a lot of digital marketing experts yet. So it's good to get new ideas and thoughts in this area. And for our listeners, we really want to hear what you have to say as well, and how you would make improvements. So please join the conversation in the comments. And so thank you so much, Isaac. And we will catch you next week. And until then, may you be healthy, wealthy, and wise.
Thanks, Devin.